Hi and welcome to another video from the CTAD Clinic. My name is Dr. Mike Lloyd and I'm the Clinic Director. In today's video I'm going to be doing a brief look at what is often missing from therapy with dissociative identity disorder or DID. Often also the case with other specified dissociative disorder, i.e. OSDD, but largely this is DID. And this is all from my clinical practice, so the observations from my clinical work and speaking to people all over the country and sometimes all over the world regarding what their previous therapy is like before they've started either therapy with us or they're just in consultation or they're looking for answers to various questions that they might have about what's going on for them. But we get into discussions and debates about what has happened in their previous therapy. This might be in private practice or this might be in sort of state-owned, i.e. NHS level or insurance-based therapy. So it depends where the person is, but I'm seeing this kind of constant thing happening. It's obviously not going to be taking place all the time, and many people would disagree with this, and it's absolutely fine, and I'm glad, because that means that you've probably had the sort of therapy which is all-encompassing and there aren't really those gaps. But this really just does come down to what people are saying to me about what the focus of their therapy has been and what a large amount of therapeutic time has actually been spent doing. And this comes down to the DID stuff about alters or parts or other. So a lot of the therapy seems to be focused on the alters, and that's understandable because it's kind of the most severe aspect of dissociation, and it's something that can be incredibly distressing and destructive and cause lots of frustrations and problems throughout life. And there's a focus about understanding alters, about trying to make sense of them, trying to understand the context, locations, times, place, all of those sort of things. All of that is correct. There needs to be a focus on that work, but it shouldn't be at the expense of all the other stuff. And this is what this video really is about, is just to, not to actually go into what needs to be done, but just to highlight that there's this gap that I've noticed in the previous therapies for people when they've come to us. And that gap is about the foundation stones of dissociation. So DID is like a higher level. We think about a pyramid. The DID stuff is the stuff that sits on the top. Or perhaps an iceberg is a better example, metaphor, because the tip of the iceberg is the alters. That's the visible stuff of dissociation. That's often what people see. It's the voices, it's the criticism, it's the change in behavior, it's the change in identity and nature. All of those alterations are very visible and therefore require and take up a lot of therapeutic time to try and make sense of. But if we're thinking about the iceberg, there's an awful lot of it underneath the level of the water, and that's often less visible. And because it's less visible, it's often less really understood, or less time and attention is paid to it. So I'm thinking about depersonalization and derealization as the key constructs with this, because there's nearly always something elemental going on with the body when it comes to dissociation. So if we think about the foundation points of higher level dissociation, depersonalization and derealization are at those foundation points. Those are keystones. They are elements of dissociation that means that there's a lack of connection with the body and either itself or with the environment around it. So the person, the system that inhabits the body has a relationship with the body that is often dysfunctional and has a relationship with the outside world that is often dysfunctional. And these things need to be understood because a lot of the stuff that goes on with alters, parts, others, are related to this lack of connection with the self and with the environment. Depersonalization is often much more prevalent. Derealization is often something that's a little bit smaller in terms of intensity or frequency, but if it exists, it absolutely has to be taken care of, has to be understood, and has to be worked with. So that's it really. My observation about one thing that seems to be a fairly obvious gap in a lot of people's DID therapy is this focus on depersonalization and derealization. It's not just understanding, it's an actual skill set. If we're thinking about the toolbox, some people leave other therapies and then they come to us and they've got a half decent toolbox for their dissociation and switching, fronting with alters, but there's really not very much there for depersonalization, derealization, and we have to really start building that with that person so that they can understand, manage, deal with, and improve their own dissociation. So building that skill set, having techniques, having procedures, having methods for reducing the impact and frequency of depersonalization events and for derealization events is absolutely critical in the overall work for DID, and that it is often missed, and so people might do very well with the higher end stuff, but they're not really looking at the foundation level. And I think it's really important that you do that. We certainly focus on those things, and I would encourage everybody to make sure if you're in DID therapy or if you're providing DID therapy that you've got a really good understanding of depersonalization and derealization within the context of that therapy. So I hope that's been useful. It's just a little observation. It's something just for people to be mindful of and to think about as they go through their therapeutic process. Don't forget the stuff that is hidden under the surface, because it's very, very important. Okay, so thanks ever so much for watching this one. Please like, subscribe, share, do all the usual sort of things, and leave comments in the boxes below. Always like reading them, and we'll keep making videos, so keep following the clinic. It is hugely appreciated. So between now and the next video, please do take great care.